Hi, it's Alex and Sara with Primal Fusion. We're going to talk about tennis elbow since that came up today. So just really quick because we're not going to spend too much time on this. Knock on wood. What's
Right.
tennis elbow?
An hour later. Tennis elbow, just regular. People have pain on the outside of the elbow, or called lateral epicondylitis, which is a fancy word for this thing hurts when you lift your arm. Because people that play tennis, when they hit their backhand, they're usually using all their arm, their head's forward, and then they start developing this pain here. So that's lateral epicondylitis, or tennis elbow.
Which is the scientific term for it hurts here.
Mm-hmm. Oh.
There. Ow.
Sorry.
Okay. You're like, okay, so they call it tennis elbow, but tennis players get it, and who else?
They call it tennis elbow because most tennis players get it, yeah, like you were saying, but from the backhand. But most people get it just because people that type a lot get it. People that lift weights, they'll get it. Especially a lot of people they'll do prone and bicep curls, and so usually people when they curl, their head goes forward. And I think we'll get into that in a second. But
what about violinists?
I mean, most people are susceptible to it. I don't know, how do you say who gets it? I mean, a lot of people get it, and it's from office workers to casual athletes to professional athletes to.
So how do you know you have it?
The outside of your elbow hurts. You pick up a milk jug and it's really heavy and
Right here.
And a lot of people get pain on the front of their arm, on the top of their arm. So they'll pick something up. And then it's their whole arm will give out, and then it hurts right there, and they'll be able to tell people that's the spot that hurts. So people lifting things, gripping things, their grip will go weak. Their lifting power will go it'll be 40 pounds to one arm to 5 pounds on the other arm. It'll be really painful.
So when I was picking up cast iron pan for a while, I remember 2 years ago, I was like, why does it hurt suddenly to try and pick up this cast iron pan?
Mm-hmm.
I couldn't grip it and hold
Yeah.
it. I was like, what's going on? Okay, so what are the normal treatment plans for tennis elbow?
So since they call it since it's a tendonitis pain, since it's usually right on the tendon attachment where the attachment of the muscle to the tendon to the bone. So
the what?
So the muscles attach to tendons, which attach the muscles to the bone.
Okay.
And so when the tendon pulls on the bone too much, it causes inflammation of that area.
Okay.
So since the tendon needs to be relaxed, they usually put the same thing that you'll see on people's knees. So tendonitis band. So you'll see people wearing these little bands on their elbows. You'll see people icing it. You'll see people stretching their forearms a lot. Heat, contrast therapies. You'll see people do massage on the elbow or on the forearm or bicep.
Is this something you go to a chiropractor, or because you work on tennis elbow a lot, and there are a lot of people who have seen you who say who do they usually see before they see you?
You can go to an acupuncturist, you can go to a chiropractor, you can go to a massage therapist. Most people go to their doctor and say, my elbow hurts, what do I do? And then they'll prescribe you a band. People go to physical therapy, anti-inflammatories. People self-medicate all sorts of different ways. But yeah, you can go to almost any medical professional, and they'll have some kind of opinion on tennis elbow.
So as a Czech practitioner and you neurosomatic therapist, how do you look at tennis elbow? How do you address it?
So to me, it's a structural issue. So people that have tennis elbow, I usually see what their breathing is like, because if they're breathing with their upper body instead of their belly, your body has to, if you can conceptualize this while we're talking, your body, as you take a breath from your chest, has to pull and lift your whole rib cage with 4 tiny muscles, versus having your diaphragm, which is connected on the, if this is your ribs, all on the inside of the bottom of the ribs, and this massive tendon that connects onto your lumbar spine, which is your lower, right by your belly button, and it almost like an umbrella unfolds it. So as you pull, the umbrella opens up, and so that creates a lot of flow, a lot of easy easy access to breath.
So it doesn't cause a strain on the neck.
Correct, yeah. So versus the muscles in the neck, when you breathe from your chest, they have to anchor to your neck, and then off the vertebrae, not only keep it stable, but lift your whole rib cage so you can take a deep breath in. Mm. And so what ends up happening is structurally you have these muscles called your scalenes, and there's 3 of them. There's a anterior, middle, and a posterior, and so between the anterior and the middle scalene, runs your brachial plexus, and that's a fancy way of saying veins, nerve, like a bundle of veins, nerves, and arteries, kind of like on a TV. So when you have, if you see someone mounted a TV on the wall and you have all these cords trickling down, so if you bundle all those cords, that's called a plexus. It's a combination of veins, nerves, and arteries. And so if on your TV you'd have arteries, an artery cable, a vein cable, and a nerve cable, those combined will be your brachial plexus coming from your neck and supplying the blood and the nerve supply to your shoulder, pec, hand, arm, forearm. So structurally, we have to make sure that you're breathing with your belly to take the pressure off those 2 muscles that are squeezing the brachial plexus closed. And so my analogy always to a tennis elbow is if you're gardening at the house, and so all of a sudden your water runs out, and you go, well, what's wrong with my faucet head? So you go and get a new faucet head, and you try that one, still no water. So you keep replacing, and you stretch the hose out, then you constrict the hose, but really there's a kink in the line closer to the water, or the water is flowing, but there's a kink somewhere, so you have to unkink the hose, and then the water flows. And that's kind of the same thing as you're getting a kink in your neck, but you're also getting a disruption of nerve supply to your arm, and it's stopping at your elbow, so you're getting pain at your elbow because of a structural issue of not breathing properly, or not moving correctly, or improper posture at the computer, or things like that.
So when somebody says I have tennis elbow, you assess their breathing, and then you check the neck. It was like, so we're at PaleoFX headquarters, and Michelle's got tennis elbow, so he just, she said, it hurts on her right, and so she was showing him, and you just went like this, how does this feel? And she's like, yeah. So you assess the neck muscles, obviously. Well, so obviously those were tense in her neck. Mm-hmm. Then what?
Well, I checked, and then I asked her if she can move. And so when I pushed on the area that I thought was the problem, she didn't have pain anymore in her elbow. So,
so usually that's just it. It's
a sign. I mean, you still have to fix the biomechanics. You still have to fix their breathing. You still have to release the tissue of the muscles. But it's almost like if it's the same hose analogy, it's almost like temporarily unbending the hose and go, oh, the water's flowing. Okay.
So you know where it comes from.
Yeah.
Okay.
And then so you go, so you don't chase it. Oh, it's in the hand now. It's a carpal tunnel. It's the tennis elbow. It's golfer's elbow. You don't chase it. It's in the forearm. It's in the bicep. It's in the shoulder. You just know, okay, well, the nerves come right out of the neck. And so if you temporarily give them access to flow better, and you go, oh, there's the problem. So then
now the pain is gone. So you identified where it is. So that's where you then work on that.
Yeah, then you start asking, why is the neck forward? Why are the scalenes being overworked or interrupted? And so then you address it from that angle instead of just chasing symptoms, which most people do, whether they'll keep stretching their forearms and their hands, but really that's not the problem.
Right, so anti-inflammatories or pain medications will just mask the symptoms, so then you never find out why or where the pain is actually coming from, so that can actually make the pain worse, and it can make the pain spread to other locations. So anti-inflammatories, though, can help temporarily. That's not, that's not the end of the line, so you have to find out where the pain is coming from. So are there any specific stretches or exercises to do, or is it with tennis elbow, is it you just don't know where it's coming from specifically, so you can't say, oh, here are stretches to do?
Yeah, it's most that, like 9 out of 10 people, it'll probably come from the neck. And then you'll have the few and far in between where it'll be coming from their hand or their mechanic, or it's coming from, or their, a body work, or they're at the computer a lot, and they're noticing, they have forward head posture, but at the same time their forearms are being used every single day. So it's hard to just give it one pinpoint, but usually just general scale. If you just Google scaling stretches, that should help. And then you got to look if you lean up against the back of a door or a wall, and you notice, wow, it's really hard getting my head to touch the wall while my back is on the wall. then you know you have probably a forehead issue. And so if it's really uncomfortable to stand like this against the wall, but really this is what it feels like to stand up against the wall, then you probably head is forward. So that way everything is starting to shift around your head. And so alleviating that stress on the neck and the breathing pattern will, first of all, fixing the breathing pattern will bring your head back, because it's hard to breathe from your mouth like this. So most people will drop their head forward to breathe with their mouth. And so
mouth breathing is not good either.
Yeah, so it's just it's not its purpose for.
So, but most of us have forward head. I have forward head.
Yeah.
And you have a little bit of forward head because you're working on people a lot. So it's something you have to work on antagonizing all the time, because most of us sit at desks and do this a lot, or we're moms and we hold our kids and we do this a lot, or have them on our hips and while we're trying to do other things, or like Aleks, practitioner is always over somebody. So it's always good to do the forward, to try and antagonize forward head, whether you know you have it or not, because most likely you do, right?
Most people have it.
I posted yesterday pull-ups, because, I can't do pull-ups right now because of my shoulders, but I posted about it being a good compound exercise to do, because that does antagonize the forward head, correct? And it's like it works so many muscles.
Yeah, I mean, if you can get your head over the bar and you do a pull-up, you're probably not going to, if you do a full pull-up where you're bringing the chest or the elbow or the hands all the way down, the elbows down, you're probably not going to do a pull-up with your face hitting the bar. So you're going to, as you pull up, bring your head back.
Yeah.
And so if it's harder for you to do a regular pull-up on a bar properly with good chest expansion and squeezing the shoulder blades together, you might want to use a band, or you might want to get on an assisted range of motion machine, or something that has like a weight that pulls you up so you can get your head back there. And because what normally happens is, as people bring their heads back, their shoulders go forward. So it's like this pick one. You want forward shoulders or forward head, right? And so it's getting both back. It's getting the head back and the shoulders back to get the proper expansion on the chest, and that's what opens up this space here. Because if this goes forward, now you've crowded. If your head goes forward, now you've crowded. And so it's not only that, but it's not only just keeping the head forward, but keeping the ribs. Because how do I word this simply? So as you
being you, who knows?
As you keep the shoulder blades down, as you retract the shoulder blades, you're going to notice my collarbone goes up, and that takes stress off of the brachial plexus also, because bones are very unforgiving. They're like logs. You lay them on top of each other, and they just lay there, and so they're going to cut off whatever circulation is there. You lay one arm on top of another, and you put bone on bone. You go, okay, well that kind of hurts, and so, but at the same time, it takes your muscles to move that arm off of you. So it's the same thing, and most people think they need the shoulders down, right? Mm-hmm. But really what's actually happening is they need the shoulders properly back, because what ends up happening is the clavicle or your collarbone will just crush your brachial plexus coming through out of your neck through your collarbone and smack it right on top of the ribs. And I think I'm getting into too much here.
Celeste was asking a question. I was trying to find it because she showed, I don't know the name of what she was talking about. Let me see, Celeste. I'm going to look. Maybe you can look it up on your phone without.
I'm trying to.
She posted it's the name of whatever it's called. Sorry, Celeste. Yeah, I couldn't pronounce that. But if you go to our Instagram,
tenosynovitis.
Yeah, if you go to our Instagram, which is just all lowercase primal_fusion, we have scroll down and look for the picture of Justin Bieber, and we have and you can swipe right on the photos. We have some exercises for forward head posture, but also for the pull-ups. Make sure you're doing pull-ups this way, not chin-ups, and not kipping or anything like that. So if you're wanting to actually
so I'm looking. It's basically BlackBerry thumb.
I've never heard of this.
Yeah, it's a common thing since smartphones came out, and gamers get it. Yeah, it's because they're always typing.
Celeste, are you a gamer? I didn't know that. Nerd alert.
So what ends up happening? It's the same thing. It's, where does it stop? Does it stop at your shoulder? Does it stop at your elbow? Does it stop at your hand? Does it stop at your thumb? So most people that are gaming or they are on their phones, they're not like this. Perfect posture, right? They're bent over, looking down, and this is exactly.
I do say.
Yeah, yeah, maybe in England, right?
Yeah.
Like, with some tea and crumpets.
Very proper.
Yeah. But it's kind of the same thing. If
Mother's thumb. Oh, also known as mother's thumb.
Never heard of it.
Wrist thumb pain. Mother's thumb.
Um,
from holding kids, they're on the wrist all the time.
Yeah, that makes sense.
That makes
I
sense.
actually had some of that too, not from mother's thumb, but father's thumb, because I'm always holding Ari, and I don't have those wimbly hips that she just sits on, so I have to like hold her, and
yeah.
So I was getting pain. It's kind of the same thing, because I mean, you got to remember, most people aren't actively holding their kid up, and I was actually going to have a whole thing about this eventually, but look, since we're talking about it, let's talk about it. Since most people don't hold their kid up, and they actively just let the shoulder hang, well, now your rotator cuffs are just laying there, and you're letting your ligaments hold you up and your tendons hold you up instead of actively holding everything up. So as this stretches down, once again, there's that collarbone angle. It starts to drop. And when it gets below 15 degrees, it starts to impinge on what the brachial plexus is doing. And what the nerves
ladies, you can see yours a little better.
Are coming.
Sorry.
It's all right.
But the nerves, that's where it drops out, and it cuts off those nerves, and it goes down the arm, right? Is that what you're saying? And so when somebody's holding their kid and they're just on their wrist all the time, that's why Celeste, yours came back. Even the anti-inflammatories helped you, but it came back because you didn't actually fix the problem, which is up here.
Yeah.
Right?
In the neck, yeah. So what I started doing is I started holding Ari up, holding her kid up. Like, actually, I figured I'd rather have muscular imbalances, which I can use some soft tissue work to get rid of, than to have ligament laxity, which means your ligaments are actually stretching and tendons are stretching, which offsets the whole relationship between your body, because ligaments are like hinges on a door. They'll stop at a certain point as they get to a certain tension. But if you stretch them, now you get a whole different range of motion that your body has to keep track of, and your body is a very calculated machine. So yeah, you get that thumb from that. Probably also impingement of your radial nerve, because all those nerves come through. And so the thumb side is the radial side, because you got the radius over here. Mother's thumb from the neck. Hold your kid. Don't kind of like sag her off. Hold it up. You can stretch out muscle pain. You can't. It's harder to tighten up ligaments and tendons.
Okay, that makes sense. I hope that helps. Yeah, so you don't have to do pull-ups, but pull-ups are a good, like, knock it all out kind of an exercise. But we have the wall lean and the instructions on our Instagram. If you just look for the picture of Justin Bieber. Yeah. And if you click on it, you can swipe on the photos, and there's instructions on how to do the wall lean. It's super easy.
Just don't do it with herniated discs in your neck.
Oh, I think it says that in there. If you have any herniated disc or anything in your back, do not do the wall lean. But if you're cool and you don't have any herniated discs and you have like a towel that you can roll up and just put on your head and do that, it's super easy. Feel the burn too. And that's a good way to antagonize as well.
Yeah, and just to make sure when you're off of that standing wall lean that you put your butt on the wall, you relax, because if you have all of a sudden rush of blood to your head, people have been known to pass out. So, so we're trying to keep this exercise safe. Not.
We don't want anybody to get hurt.
Yeah.
And when I started training Muay Thai, and Coach Aleks was teaching me how to keep your arm, it was so hard for me to have he said you got to have your chin in, and I couldn't keep my chin in, and it was just so hard, and that's what made me realize like I have really bad forward head. So anywho,
kids are heavy. Yeah,
no problem, Celeste. Yes, kids are very heavy.
So switch hands very often. You can use that as an exercise. Just make sure shoulders stay back,
keep balanced,
hold, squeeze the bicep, make sure your shoulders don't sag, and then when it gets tired, you just switch sides, and then you can make it could be the best baby carrier ever.
Yep.
Same thing with groceries. Don't just let them sag. Don't just let your arms just kind of sag while you farmers walk.
Do some shrugs.
Actively engage your body, so that way your body learns that, hey, when you have load in your hands, you want to make sure that your rib cage don't just compress the load there.
I think we're done.
We're done.
All right. Send us your questions if you have them. We'll talk to you guys soon.
Bye.
Bye.